It means availability of a method that has been in higher income countries for decades and has been available in the capitals of many countries where we work, but only for the wealthiest of women.
Honestly, this product has been a game changer for women in the United States and in other developed countries. And it commands a significant portion of the overall method mix, due in part to its unique attributes, which include its long-acting duration, coupled with its effect to reduce bleeding.
Besides being a very effective contraceptive, it has non-contraceptive health benefits that so many women could benefit from. Reduction in heavy bleeding and a potential to decrease anemia are important attributes for this product.
So to me, equitable access means providing women in lower and middle income countries the same opportunity to try this method and to decide for themselves whether it works for them.
It's a life-saving tool that should be able to prevent the death of such a woman, because it does. Pregnancy continues to kill women. And a product like this that we know will contribute to reduction of unnecessary maternal deaths. If you are going to be a human rights based, we really must advocate for that in any way we can, that this product should be availed, of course, among other methods.
In Brazil, the Copper IUD is available in the public sector, but not the levonorgestrel 52 milligram or the implant. Consequently, there are many disadvantages for women, because if you take into account what is the cost of unplanned pregnancy and what is the cost of hormonal IUD in the public sector, obviously the unplanned pregnancy is extremely high, the cost, than a hormonal IUD.
One of the things we've learned over decades of developing and offering contraceptives is the critical importance of choice, and that women have different preferences and needs at different points in their reproductive lifespan, and that they need choices, a range of choices, because no one method is going to work for everyone. The role of the hormonal IUS to women around the world and access to it around the world, I feel, is incredibly important, because this is one of the premier methods of contraception from a safety and efficacy point of view. And the fact that so many women use this in Europe and the United States is fantastic. Women everywhere should have access to such a safe and efficacious method like the hormonal IUS. It's also just critical that it becomes part of a basket of choices.
Women who are living in settings where there's uncertainties, fragility from whatever causes, whether it's natural disaster, climate change that has become such a big driver of health needs, whether it is conflict. Individuals like those really need methods like this that are comfortable, they can use with ease, and can also be used for a long duration of time. I'll start off with the fact that I don't think you can place a value to human life. If you cannot do that, then there's no cost that is too much or too high for us to be able to pay.
I think it's worth it because of the unique properties of this method. Right now, because we have an opportunity to get the product at a price point that is feasible for many more country programs.
We know that women actually are the drivers of economies in many of the settings that we work in. And so if we provide them with an opportunity to have a method like this and others again that can allow them to realize their full potential, finish school, have careers, be able to be productive members of society, we know that in cost we may consider actually will be counterbalanced by that, where the initial investments may look heavy, but then in the long run, it is also a long-acting and reversible method that's going to be used for long. When you actually look at the amount of money spent over the time of use of that method, it's really not as heavy as when you spread it out across the duration of use.
There will be, of course, trade-offs, and country programs need to think through candidly what they won't be able to fund if they introduce the hormonal IUD. But this is a high-quality product that has been popular in the developed world for decades. There's a real momentum and a lot of technical resources available and champions who want to work together to see this product considered.
We should have done this 30 years ago. We didn't do it earlier, but now is the time to make sure that we accelerate and expand access to this and other methods.
The access group's role was critical, indeed essential, in broadening access to this method. Without the collaboration of the various partners along with the donors, I'm absolutely convinced that we would be in the same place we were a decade ago, hoping, but with very limited access for women globally. And hope is not a strategy.
I don't think we would have gotten a product into the UNFPA and USAID catalogs without the work of the access group, or not as quickly as we were able to. It really served as a collaboration point for multiple pilots and efforts that were funded by multiple donors. I think working in silos would have not caught the attention of manufacturers and donor commodity decision makers to showcase an organized platform and really build on complicated introduction efforts.
We really needed the commitment of the access group along with the donors to make this product a reality for women in low and middle income countries.
And as well, the group executed a learning agenda that informed us about the acceptability and continuation of this product and information on whether new family planning users or switchers were more interested.
I do want to commend the access group for its being involved and leading this exercise, especially around expansion into the public sector. I think what I've seen for the time that I've interacted with it is also being a platform for learning.
The Hormonal IUD Access Group has played a great role in making sure that information is shared, in highlighting progress, and in identifying and helping to remove barriers to access for the hormonal IUD. I think its track record has been extremely positive in that regard, and in finding ways to promote the agenda and the access to such an important method of contraception.
I think, again, an important opportunity for the access group to continue doing what it is doing, but also maybe rethinking what are the next frontiers that we should be working on. What are those opportunities? How do we use digital health tools, including AI now, to sort of think through how we can advance this even further?
I think that the access group can play an important role in global coordination, in cross-learning, in being a liaison with donors and manufacturers, with advocacy for governments, and providing continued evidence distribution, evidence generation, and getting the words out as new evidence about this product becomes available. I think it's critical that assessments of programs that are not working are done such that the method can not be tarnished for unfounded reasons. In addition, I think the health benefits of this method need to be conveyed in new and in interesting ways. For example, FHI 360, in collaboration with UNITID in Nairobi, is conducting a study of the hormonal IUD in anemic women to determine whether the method can improve hemoglobin and their anemia.
We need to keep the attention on these initial country introduction plans and keep efforts in the light. We are seeing some key barriers of getting products and services down to the last mile and creating awareness and demand for the hormonal IUD. We need multiple entities to hear about the challenges that countries and regional efforts are facing and coordinate to address it. We also need to learn more about what it takes to successfully introduce this product and who the women are who choose it. Research is being conducted, and the Access Group has a role to be a key support for research utilization for these learning efforts.
Part of the many healthcare providers believe that women in low and middle income countries don't like amenorrhea, but nobody asks.
Offering choices actually enables access.
I think the future for the hormonal IUD is really bright.